3, go.
Hello all, I'm Dr. Timani, and today I would like to feature fillers in my video. The reason is that this is the special of the month in both practices, in Springs Dermatology and in Johns Creek Dermatology. And the reason we are celebrating them is because of the holidays and because of the very exciting advances in fillers in the past 1 to 2 years. Before I start, I would like to apologize for my face. It's a little bit pink, dry, and blotchy. I just recovered from a microneedling that I will share with you through a video as well, just last Thursday. So I think I'm healing very, very well with no makeup on my skin except the eyes and the lips. But let's get back to fillers and the updates in that cosmetic option. We have many more fillers on the market, and they tend to be gentler, more natural. They last longer, and they induce a new tissue formation as well. And you used to come and get a filler done in a wrinkle or a dent and be happy, and then come back in a couple of months and get some more, and so on and so on. So there wasn't a lot of long-term gratitude. Now that is our goal. And the reason we can achieve better and longer term gratitude is because we understand the aging process a lot better. We used to think it's just breaking down of collagen and elastic bundles or disappearance of fat. Now we know better. We know that there's laxity and looseness in key ligaments in the face, and we also know that there's bone resorption. So these days we apply fillers to build and rebuild the foundation and recontour before we actually get into a line and a dent, and we fine-tune that line or dent. And what I want to talk about today is the hyaluronic acids, and they are the ones featured in this special. I like them a lot. The reason is that they are very natural to our skin. In fact, we are born with hyaluronic acid when we're babies, and that's why we're so doughy and very plump. The reason I like it is that it actually can be reversible, and it can be melted away using an enzyme called hyaluronidase. What is exciting about this hyaluronidase is that if you get a bump or a lump that you don't like, we can melt the filler and only the filler and not the natural hyaluronic acid that you have. And before I run the experiment, I want to add that fillers are used in special techniques to induce new collagen and new elastic bundles as well. So the new collagen formation. But let's come close here and let's go ahead and play around with this experiment right here. And I'm going to just put a glob of this transparent jelly material. And this is the hyaluronidase right here, and we are going to inject it, and you'll see it become like a water droplet. And I think what we can do is that we can pretty much mash that away. Look at that, that's so cool. It's pretty much gone. So what I wanted to say also is that there are many other fillers, and they all have their place, and I like them all. In the right hands with the right technique, they all have their place. But I can't wait to meet you all and consult with you to see if these fillers are the right fillers for you or you need other options. And I can't wait in future episodes to talk a little bit more about the technique of fillers and advancements in the technique as well. You'd be hearing a lot about the cannula, which is a blunt needle. I will show you what a cannula looks like. Maybe I'll try to inject a patient as well so that you can see, and we'll talk about the pluses of a cannula, which is now the standard of care in the advanced injection technique. But I can't wait to hear all your questions and concerns, and I would love to discuss them in future videos. This is Dr. Timani signing out. Thank you so much.